right, today we're gonna talk about modifications. So this is something that happens very frequently in the gym, and a lot of times it happens immediately and you don't really have time to plan for it. So you have to really understand what needs to be modified, how it needs to be modified in order for you to get back to class and keep the format of the class and get that athlete in a safe place so they can continue training. So there are a few reasons why you would want to modify. The first is for injury. So if an athlete is injured, it's our job as a coach to make sure that the athlete is training safely. So if they are already injured, we want to make sure that we are allowing them the space to heal whatever piece of the puzzle it is. So if their shoulder is injured, we want to make sure that we're only doing lower body core, things like that. Nothing that's going to exacerbate the issue that they already have. The next is going to be mobility. So oftentimes athletes are aggressive at learning and trying new skills, but they don't necessarily have the range of motion in order to allow them to do that safely. So it's our job as a coach to kind of reel them back and make sure that they are in a good position that's going to promote longevity within the sport and whatever movement they're doing, instead of doing butterfly pull-ups or kipping pull-ups when they can barely put their hands over their head. The next one is going to be skill and coordination. So a lot of times athletes just aren't quite there yet, or other athletes struggle to acquire skills as quickly as others. So oftentimes if you start seeing an athlete who is struggling with learning a skill, or we might have progressed through to the next skill and they're not quite there yet, we want to take them back to make sure that they're in the range that works for them currently, even if it's not exactly what the rest of the class is doing. The last piece is obviously safety. So if you fear for the safety of your athlete, it's up to us to get our athlete moving in a safer either position or movement or anything like that. So a lot of times you see this in what I like to call our daredevil athletes. So these are the ones who have like zero fear and they are just ready to tackle everything. But they do that by compromising the integrity of their lifts. So now as a coach, you're seeing possible back, shoulder, knee, hip injuries based on the type of mechanics they have. So it's our job to inform them of what they're doing, show them how to do it correctly, and then give them a new modification to help work them back up to that skill that they really want to do. Most modifications are a variation within the standard progression of a movement, but there's so much more that goes into modifying than just picking the one step down option. So say a pull-up, then before that becomes a ring row, and before that is a ring row but standing higher. So instead of just picking one modification down the chain, there's a lot more that goes into it. So there are three categories in which you would have to modify. So the first one is the obvious one, it's the movement. So when an athlete struggles to complete a movement, or they're incapable of the skill level of a movement, it is up to us to put them in a much better and safer environment to complete the task. So for example, if an athlete's doing an overhead squat but lacks the mobility in the shoulders and or hips to get to the desired squat range, you have a few options. You can give them a back squat, front squat, air squat. So you have a few things that you can work with in order to keep them moving within the class, but also not injure themselves. The next one is you can modify the reps and or time range. So this is usually the case for deconditioned or newer athletes. You may have to modify the number of reps to keep them moving. So for example, if you had a workout that calls for say 20 wall balls every round, but your newer deconditioned athlete can only tackle maybe 3-ish at a time, well, I don't want them hanging out at the wall balls for the entire workout, so I may lessen their rep range so that way it's a more manageable set so they can kind of keep moving throughout the workout. Your other option is changing the time frame. So if my athlete struggles moving for just a few minutes at a time and it calls for a 20-minute AMRAP today, I have many options, but one of which is to just be like, okay, you're gonna do a 10-minute AMRAP or a 15-minute AMRAP, or you can have them complete one round and then tell them you're gonna do one round and then you're gonna give yourself 2 to 3 minute rest. If you're feeling good, you're gonna do another round, and then follow in that order for the 20 minutes. So the whole idea is to keep them moving, but don't let them overdo it. They have to still gradually build up to that time and rep number. The last one is probably the most challenging to adapt to, is going to be the effort level. So this is for our athletes who are just not capable or haven't learned how to tap into their full intensity level. So they're going through workouts and it prescribes some high intensity, but they are so used to staying at, say, like an 80%. So it's our job to push them and understand when they're ready to be pushed to that level, to tap in or dig deeper and try to get to that new performance measure. This is something that takes a lot of practice, and you have to really understand your athletes in order to accomplish this piece. But once you've established what kind of modification is necessary, you can choose what modification you're going to prescribe to your athlete. So based on the category of modification, whether it's movement, reps, time, effort, you will be able to choose, for example, say somebody needs a modification for a pull-up. There's a lot more that goes into it. You can't just make them do ring rows all the time. Sometimes it might be jumping pull-ups. Sometimes it might be banded pull-ups. Sometimes it might be banded pull-aparts. So one movement can take into account a bunch of different modifications. So there are two things that need to be considered before you actually choose the movement selection. So the first is what type or category of modification is needed. So that's what we just talked about. The second is going to be probably the most crucial piece, and the harder piece of the puzzle is going to be what is the intention of the workout. So it gets challenging sometimes, like I said, because you can use two different modifications for the same movement, but this might help. So if an athlete, say, does not have a pull-up yet, but the workout prescribes pull-ups within it, if it's a, say, workout, it's a 20-minute AMRAP at 70 to 80% effort, that's a great workout to prescribe something like a ring row. A ring row is more of a strength movement because once you kind of hit that fatigue place, it's not like you can push through or kip with your hips or things like that. Like, you have to physically stop what you're doing, recoup, and then go again. So at a 70 to 80% effort level, that's a really good place to be. So that would be a fantastic modification. However, if you were doing Fran, the whole piece of that is high intensity, high output. So a ring row would not be as good of a modification. There, I would look for something like a jumping pull-up. So this is going to keep my athlete moving, keep their heart rate up, keep it intense so they can hop back on their barbell and cruise through the rest of the workout. So learning how to modify is a little tricky, but with some practice, it's totally manageable, and it's actually a lot of fun coming up with new and fun ways to keep the athletes moving, because at the end of the day, it's not just about the movement, it's about the intent, but it's also about the enjoyability factor for your athlete. If someone's injured and they have like a 6-week healing time, they're not gonna always wanna sub everything out for an air squat. So you have to get creative, you have to help them mentally manage what it is that they're doing and wanna come back for more and still have that mental and physical intent in their workout. So recap, there's a lot that goes into this. We'll be practicing a lot throughout this PCD course as far as how to modify, when to modify, things like that. But the biggest thing to keep in mind is always remember the intent of the workout. That's going to be the key factor, and it's really going to help you choose the best modification.